Cognitive Behavior Theory, presented by Amber Allison, Cerrone Vaughn, and Kyle Peterson. What is CBT? The term stands for Cognitive Behavior Theory. CBT is a psychotherapy tool to help change an individual's thought process to healthier thinking, typically used to treat addiction, anxiety, and depression along with many other disorders. Now, the founder of CBT is Aaron Beck back in 1970, explained that cognitive therapy based on cognitive theory is designed to modify the individual's idiosyncratic maladaptive ideation. The basic cognitive technique consists of delineating the individual's specific misconceptions, distortions, and maladaptive assumptions, and of testing their validity and reasonableness. By loosening the grip of his perceptive, distorted ideation, the patient is able to formulate his experiences more realistically. Clinical experience as well as some experimental studies indicate that such cognitive restructuring leads to symptom relief. The image that you're looking at right now is a visualization of three components that consist of thoughts, emotion, and behavior. Now, assuming these three components has a negative output, the ultimate end goal will end to CBT, which is cognitive behavior therapy. And as stated, the goal of CBT is to eliminate irrational thoughts and beliefs to produce positive outcomes. Now, moving on to the history of CBT. CBT has many influences, and one being Aaron T. Beck, who's known as the father of cognitive behavioral therapy. And due to his extensive research, he credited CBT to three main focuses. First, the phenomenological approach to psychology. Second, structural theory and depth psychology. And last but not least, cognitive psychology. Cognitive therapy was developed out of Beck's early research on depression. He trained in psychoanalysis, where Beck tried to substantiate Freud's theory of depression as having at its core anger turned on the self. The cognitive theory of emotional disorder was developed to describe the shifts in information processing that occur in psychopathology. Now, another influential individual was Albert Ellis in 1962, where he similarly focused on patients' thoughts and beliefs. Both Ellis and Beck believe that people can consciously adopt reason, and both view the patient's underlying assumptions as targets of intervention. To expand on the knowledge of cognitive theory, Judith S. Beck outlined 10 key principles for CBT in her book, Cognitive Behavior Therapy, Basics and Beyond, written in 2011. And she identified these principles as key components that were instrumental to cognitive therapy in relation to cognitive behavior therapy. Some of these principles are: CBT is based on an ever-evolving formulation of the patient and his or her problems in cognitive terms. CBT requires a good client-therapist relationship. CBT is goal-oriented and problem-focused. CBT aims to be time-limited. CBT sessions are structured. And last, CBT uses a variety of techniques to change thinking, mood, and behavior. Due to the strong framework of cognitive theory, interventions were developed and implemented to help clients reach their goals. Cognitive interventions are techniques that encourage the client to realistically rethink such self-beliefs while looking at alternatives and more objective and realistic explanations. Some of these interventions are behavior activation. This is assignments that encourage clients to experience or practice healthy behaviors. Reinforcement scheduling. Reinforcement and punishment set up to encourage behavior change. Cognitive restructuring. These are methods used to identify, correct, and remove negative or irrational thoughts. And lastly, psychoeducation. This teaches clients life skills that will help encourage change or educating clients about the disorder itself. Because of the interventions that stem from cognitive theory, researchers were able to identify strengths that would be applicable and helpful to clients in a therapeutic setting. The most important strength that stands out is that it's supported and established through extensive research and evidence-based for multiple psychiatric disorders. Another key strength has shown to be positively useful and effective for individuals of all ages. That includes children, adolescents, young, middle-aged, and older adults. It reduces symptoms expressions by modifying maladaptive thoughts, attitudes, and beliefs, and faulty information biases that characterize emotional disturbance. It provides a structured approach that provides a focus for both the clinician and client, allowing both to prioritize problems and goals. Multiple targeted therapies also can come from cognitive theory. Some of these therapies that are useful is trauma-focused CBT, rational motive therapy, and also cognitive processing therapy. And also, it's suitable for clinical social work practice, which is important in social work. There's a saying, for every strength, there's a weakness. With that being said, it applies to cognitive theory and also therapeutic interventions such as cognitive behavior therapy, which is widely used. Some of the limitations are cognitive theory focuses on the individual rather than person and environment, which is an important aspect of social work. Because of this, cognitive theory may be more useful for social workers and micro practices as opposed to those in macro practice social work settings. Last, cognitive theory may give the social worker too much authority as it seeks to change the thoughts and behaviors of the client. Now, this may reference to the Code of Ethics, where it states that social workers respect the inherent dignity and worth of the person and promote self-determination. Social workers must be careful of this, especially when working with vulnerable groups like children and minorities. To sum up what we just learned, cognitive theory builds on behavior theory by suggesting that thoughts and consequences affect our behavior. Cognitive theory is the basis of cognitive behavioral therapy, which focuses on thoughts, emotions, and behavior. Cognitive theory interventions focuses on change faulty cognitions to be more objective and realistic. It also has evidence-based findings supporting positive outcomes. And last but not least, concepts and interventions can be applied from children to older adults of different ethnicities.